Hello, I'm Nikki Kirk, Community Midwife based at Lincoln County Hospital, working out in the community of the doctor's surgeries for United Lincolnshire Hospitals Trust. We provide antenatal, postnatal care and a home birth service. You normally book in to see a midwife when you're 6 to 12 weeks pregnant. At that point we can do all of your paperwork to organise your scans, give you a health promotion, talk to you about all of your care through the pregnancy, take a family history, give you dietary advice, refer you to smoking cessation people, talk to you about breastfeeding and just make sure that we give you the most appropriate care. When you come to the midwife's appointment, she'll just be making sure that you're in general good health and there's no concerns with the unborn baby really. We'll be checking your blood pressure, also check your swelling, make sure there's no excessive swelling. Do a fundal height measurement to check that your uterus is growing with the pregnancy. We'll have a dip of a urine sample, ask you to bring a fresh sample with you every time. And just making sure that you're generally well in yourself and that there's no concerns and nothing we need to kind of do something more about. Following on from that, as your pregnancy progresses, we'll also talk to you about breastfeeding, the benefits of breastfeeding to you and your baby. We'll also talk to you about the presentation of your baby. We'll be checking from 34 weeks onwards what presentation, what position your baby's in to make sure that your baby's going to be head down for the birth. If you're less than 12 weeks pregnant, it's best to phone your doctor, your GP or your out-of-hours service to get advice. If you're between 12 weeks and 20 weeks, contact your midwife if she's available. If she's not available, again contact your doctor. If you're over 20 weeks, you can self-refer to the number that's in your notes to the Antenatal Assessment Centre, or they'll be able to check you over. Your baby, the day of the baby's birth is called a star day. We don't count that day when we come to see you. So if you have your baby, we come and visit you the next day, which will be day 1. So we'd come and see you day 1, day 2, day 3. It may not be both of those days, day 2 and day 3. It would depend on your medical well-being, on you and your baby. If you're both well, we might just come day 1 and day 3. We'll then come and see you again on day 5, where we weigh baby and do baby's heel prick test. And then we also come and see you on day 9, at which point we would normally discharge you if you're well. But we do it individually, and if there's any concerns or mum isn't ready to be discharged, then we leave it and come back and discharge you at a later date. We put all of your information into the baby's red child health record and bring those main notes back to the hospital. At your booking appointment, we talk about your place of preference for your birth. It can either be in hospital or at home. What we say to you is you want to have your baby in the place you feel the most safe, secure and relaxed. People think of home births as being messy events. They're not. We take away all your clinical waste. We've got a very stringent home birth criteria, and as long as we follow that criteria, it's a safe process. If there was anything to be said about risk, if there were any concerns about the woman or the baby, the midwives would be the first ones to say, right, we need to transfer into hospital. Home birth can be a wonderful experience, and it's something that we do encourage ladies to think about. Thanks for your time, hope you've enjoyed watching this. Further information is available on this site. Please have a look and we look forward to seeing you soon.